Welcome to Business Chat, the platform dedicated to small businesses, freelancers, and startups. We talk about all the aspects of business, from sales to marketing to administration. Today's chat is not business related, but is on something very important to all of us, which is our mental health. I wanted to talk to Dr. Cyrus Abbasian, who is a psychiatrist consultant based in London, but works with clients all over the world. I wanted to talk to Dr. Abbasian about mental illness and what people could do in this stressful period. So please enjoy my conversation with Dr. Abbasian. Dr. Abbasian, welcome. How are you?
Good. Thank you for having me.
My pleasure. So, Dr. Abbasian, I will start by, if you don't mind, introducing a little bit yourself. What kind of client, what kind of patients are you usually work with?
So I'm a consultant psychiatrist, and I'm also addiction specialist. And typical patients I manage are between the ages of 18 and 65, and they have severe mental health issues, for example, schizophrenia or bipolar. And this is my NHS job in London. I do some private work as well, and I do some work online via telepsychiatry. And the patients that we treat privately tend to have more moderate mental health conditions, depression and anxiety disorders. Also, as an addiction specialist, I see private patients who have issues with alcohol dependency or drugs misuse.
Absolutely. And I ask you to join me today because it will be very interesting to know a little bit more about mental illness, because it's a very wide range. But I would like you to explain a little bit more about mental illness, first of all, and especially the subtle one, the one that is not very visible, the one that at some point come up very strongly, but nobody maybe ever noticed it. Because of course we know about schizophrenia, or we know about heavy depression, but there are a lot of levels that I would like you to get through that and teach us something.
So generally speaking, we have mild, moderate, and severe mental health conditions. The severe ones are obvious to anyone. Even a lay person will know that this person is affected by mania, for example, or psychosis. The moderate ones, it causes quite significant issues with the person's everyday life. They can lose their career, they can fall out with their family as a result. It could lead to suicide, self-harm, or drug and alcohol misuse. The milder ones tend to be more subtle, and they're the ones who get missed out. So a patient with say mild depression or mild anxiety, especially if they're highly functioning, if they're educated, they've got good background, they've got family support, they've got good jobs, they can overcompensate and cover for how depressed and anxious they are. So they come across as normal. And often in the clinic, when they see me, they say, "Oh, doctor, I'm wearing a mask all the time." So people who know me think everything is okay. But inside, I'm hurting. Inside, I'm depressed, I'm anxious. And I've got these chronic thoughts of suicide. And also, I need to talk about stigma very briefly here.
Absolutely.
Mental illness is stigmatized. So a lot of people feel ashamed to talk about what's going on inside their head because they feel that they're not going to be believed, they're going to be ridiculed, or it could lead to some disadvantage in their life in the future. So particularly those with milder mental health conditions are less likely to come to specialists for help and support. And unfortunately, the problem doesn't go away. The longer you leave it, the worse it becomes prognostically. So advice we give patients is that if you have any mental health issues, if you feel depressed or anxious, just go and speak to your GP or seek help from a professional.
Absolutely. And how did people with mental illness being affected by this quarantine?
So it's interesting because when the quarantine started, just at the beginning of the lockdown, for the first couple of weeks, things were pretty quiet. A lot of our patients were staying at home, they were self-isolating, and they were suffering in silence, and they were really just worried about the consequences, the physical harm caused by this virus and the physical manifestations of COVID-19. However, now we've become really busy. As the coronavirus wave has come down, the mental health one has gone up. And we're seeing a lot of patients who are presenting with sort of secondary manifestation of COVID-19 and also the lockdown, of depression, anxiety, psychosis even that's caused as a result of this. And there's a really strong correlation between poverty, unemployment, and mental health conditions. A lot of evidence comes, for example, from the former Soviet Union countries after the breakdown of USSR. It led to economic depression, that led to depression, anxiety, and alcohol misuse. And the worry that I have as a psychiatrist is that there's been so much focus on bringing this curve down. We haven't really thought about the longer term consequences of the lockdown, and in terms of the economic effect and the effect that will have on mental health of the population.
Absolutely. So we always think, yes, we always think about, the curve, of course, and the economical consequences, but we never think about, what is the shadow that will be dragged out for many, many years in terms of, mental illness and mental reaction of this. Absolutely. So what people with mental illness could do actually in this stressful period?
So, I mean, it's important to get help and get advice if you need to. Those with severe mental illness, they need extra help and support. So someone with a severe mental illness or schizophrenia has a care coordinator, a nurse who goes, visits them at home to make sure they have enough provisions. So sometimes patients could be so terrified and so paranoid they're not going to be leaving home. So we have to make sure they have adequate food, nutrition, they get their medications. That's really important. It's a very basic level. Those with milder mental health conditions, so the advice I give them is that carry on taking your treatment as prescribed. Don't watch too much news. So we are bombarded with negative stuff on the news regarding how damaging this coronavirus is. And a lot of it also is repetitive. Also, there's a lot of fake and false news out there, particularly on social media. And what it comes down, 99% of the population will not be affected by this virus. So most of us shouldn't worry. But it's important to follow government guidelines, and it's important to reduce our anxiety levels to as low as possible. It's important to go out daily and exercise. It's important to try and keep yourself occupied at home, do positive things, work from home if you can, watch comedy on television, have Zoom parties, have Zoom dinner parties. So we have to be physically distant, not socially distant.
Yeah.
So I mean, we're having a nice chat now, but we're not there physically. So there's no risk of us catching the virus from each other. So it's important to be connected with your family and with your friends, and just keep your spirits high. And then we're gradually easing out of the lockdown, so things will become easier for all of us in the next few weeks.
Yeah, absolutely. I found it quite interesting. I usually talk about this with the psychologist or psychiatrist I meet, because there was this friend of mine in Italy that was working for a mental illness association or something, and they were talking about mental hygiene, which is something that I found very, very strange. That I never heard it in any other part of the world. Because for me, whatever you just mentioned, don't watch too much news. Try to watch comedy, try to relax with friends, try to catch up. For me, is very much mental hygiene. And I wish that the concept, because there is just mental illness and normality, but mental hygiene is very important to just not to get mentally ill. What do you think?
So well-being measures is really, really important. So whenever I see a patient for the first time, I mean, people think I'm a psychiatrist, so I prescribe medication. I'll bring my notepad and prescribe something for them. So the first assessment takes an hour, and I basically look at how I can change person's lifestyle to make it better and easier for them to reduce the likelihood of mental health issues. So I have people who work 80 hours a week. So the reason they're anxious and depressed is because they don't have a proper work-life balance. And that mental hygiene, which is related to general well-being measures, is so important. So we shouldn't work really more than 30 hours a week. And if you have a proper work-life balance, it's just so important. You know, it keeps you healthy, it keeps you physically well, you make sure you do your exercise. I mean, if you're too tired because of your work, you don't have any energy to exercise. You need to eat well, a proper healthy, balanced diet. You need to go on holidays as necessary. You need to go out, meet your friends at weekends, and be sort of connected with others. And you need to try and reduce your stress levels. You can do yoga, for example. You can meditate. You can have therapy. And these issues are really important in bringing your stress levels down, and it leads to sort of well-being measures, and that ultimately has an effect in terms of mental hygiene. Also, reduce your alcohol intake. Don't take illicit drugs. Don't smoke. Don't drink too much caffeinated drinks. You know, all these measures really makes a difference. So one advice I give my patients who don't do any exercise is that go for a 30-minute walk, at least, perhaps an hour every day. Just walk everywhere. And just a simple change in your lifestyle from driving everywhere to walking everywhere could really turn things around for you. So that's the most basic level of treatment or management I offer all my patients.
Absolutely. Well, thank you so much. It's been invaluable what you just said, because for me it was very important to give this message across from an expert. So thank you so much, doctor. I hope to have the possibility at some point to speak with you about something else. Who knows? Thank you so much for being with me today.
Sure. Look after yourself and take care.
Bye.